Hello, good morning, and welcome back. I am Dr. Anastasia Horonis, clinical psychologist and author of the book, The Dopamine Brain. Now, if you've been following along, you know that I like to jump on here and share some daily reflections with you for those of you who are in the process of addiction recovery. I hope you are all progressing well. Today is a new day, a fresh day to re-engage with recovery in whatever way that might look like for you. Now, if you are new to the concept of addiction recovery, or you are considering whether you might want to make some changes to the way you use a particular substance or engage with a particular behavior in your life, then welcome. I jump on and I share daily reflections around particular themes that I hear about in the clients and patients that I work with. Now, in the past, I have read out of some daily reflection books and spoken around those themes and shared my thoughts around them. But recently, I've actually been writing some daily reflections of my own. Again, this is based on patterns and themes that I hear about in the clinic from patients who are going through the process of abstinence or harm reduction and trying to change the relationship they have with alcohol, drugs, substances, behaviors, etc. So I've written a daily reflection for today, and it is all around the theme of when recovery doesn't feel like what it thought you would feel like, and letting go of some of the expectations that we might have around how addiction recovery will feel. So I'm going to read it out to you, and then I'm going to share a couple of my thoughts as a clinician. So the theme is when recovery doesn't feel how you thought it would. Most people begin recovery with an idea of how it's supposed to feel. Clear, calm, purposeful, maybe even joyful. But real recovery is rarely neat. It can be messy, emotional, unpredictable, and full of moments that don't necessarily fit the picture that someone might have had in mind. Letting go of those expectations can be helpful. It doesn't mean lowering the bar, it just means making room for reality. Healing doesn't always feel good while it's happening. Sometimes it feels confusing, flat, or uncomfortable. When people stop trying to make recovery look or feel a certain way, they start to experience it as it is. And that acceptance and presence with reality as it is in that very moment is a powerful tool to harness in recovery. Today, I invite you to notice any quiet disappointment you might have about how you think recovery should feel. Then try saying, "This is what it feels like right now, and I can work with this. This moment in time might not feel very good, but maintain hope that the future can feel better." So I wrote around this topic because I hear a lot of people coming in with grand expectations for how recovery is going to go and how recovery is going to feel. And I think it's always important that we maintain this dialectical approach to recovery. On the one hand, recovery can feel fantastic. It can open up so many incredible, wonderful opportunities for us. It can feel so much better. We can feel so much healthier within ourselves. We can feel like we can connect with people better, be more focused in our day-to-day life. There are so many positives that can come with addiction recovery and that can feel really good. At the same time, on the other hand, there are parts of addiction recovery that can and will feel very hard, very painful. People will often feel like, what's the point? It's too hard. I don't want to continue doing this. It feels awful. And it's important that we be prepared and expect those moments to arise. If people just sit on the side of being hopeful in a way that almost invites some ignorance about how addiction recovery will feel, they're actually probably quite at risk when it comes to lapses and relapses. If we have this blind hope for everything will just get better once I'm in addiction recovery, we leave ourselves vulnerable. So it's important to always hold space for both. Yes, addiction recovery can feel absolutely wonderful, and there will be times that it doesn't feel that way. And when those times come about, instead of getting stuck and bogged down in them, we want to almost feel like, there you are. I was expecting you to show up at some point. I knew that there would be a point at which this didn't actually feel that good. Here it is. It's come. We almost welcome it in, let it pass by as it will, and kind of move through the experience and come out the other end of it. If we expect that there will be times things don't feel good, we will be more prepared to manage and deal with them when those experiences come about. So this is my daily reflection for you to kind of think of for today. I invite you to share your own reflections and thoughts around this in the comment section below. I would love to hear from how this might feel relevant to your day or to your recovery process. And always looking forward to hear from you. I wish you all the best with recovery and have a great day ahead.